I'm Erin McCann with Healthcare IT News, and I'm here with Alisa Ray, Executive Director and CEO of CCHIT. Hi Alisa, thank you so much for being here today. I appreciate it. So my first question for you is what is the significance of certification in this era of meaningful use?
Well, the significance of certification in any industry in any time, the real purpose is to sort of reduce risk or increase assurance, increase confidence. So meaningful use, we had a number of goals that the government's talked about there. I think in particular, certification has made providers feel a lot more comfortable about adoption. We've seen an explosion in adoption, right? It's been a very successful part of meaningful use. Certifications also incredibly raised the bar on functionality of EHRs, right? Or prior to certification, I think the provider community had many questions about would these different systems do the basic things I need to do to take care of a patient? Well, now we've pretty much solved that problem through years of certification. We have a number of different alternatives out there, different systems that can do just that. A number of alternatives in types of technology, right? In platforms and cost and price points. So there are many more options for providers, and also their confidence is a lot higher. We still have a long ways to go. In a way, this side effect of this increase in adoption is that it can sort of expose some of the imperfections in the system, but that's okay because more people are using them and they're ready to have that dialogue about how do we continue to advance and improve our healthcare system using technology. It's no longer just a matter of convincing providers, should I adopt an EHR, but which one, and how do I move on to the next phase, which is coordinating care, really improving quality for patients.
Now, what are some of the biggest requirements for a certified EHR?
Well, with the move to the new 2014 criteria, with an eye towards stage 2 of meaningful use, the bar has really stepped up in a couple of areas. We communicate with the vendors that the emphasis on the clinical quality measures and the testing there is much more rigorous. There's a lot more work to do to get the systems ready for that. And also, providers should have more confidence in the systems and their ability to compute. And then again, our federal government in helping think about endpoints and uses of data, the quality of that data is going to be much better too. And Erin, the second area that I think that's really noteworthy in 2014 is the focus on interoperability. Really raised the bar much higher there. So those are really important pieces.
Now, just a couple of days ago, CCHIT announced a new HIE compliance testing program. Could you tell us a little bit more about that?
Yes, I would. That is another piece of work that we're doing. We're doing that in cooperation and partnership with two organizations. Healthy Way, which is the organization that operates the eHealth Exchange. It's evolved from the nationwide HIN, right, over the years. They've been operating 3-4 years with lives on their big network. The other organization is the New York eHealth Collaborative's HIE and EHR Joint Interoperability Work Group. Those two came together to really talk about making data move through the exchange, of course, but then also across states. There are a number of states, 18 different states, that are participating in that program too. I think over half the population is represented in those states. So what they did was they got together and using a lot of the standards that are commonly accepted and part of meaningful use and in other areas, created a set of test cases or use cases. And we were selected through a competitive profiling process to work as their compliance testing body. So there's been a lot of work, a lot of planning that's gone into this. The testing will be using an automated test environment where we can actually sort of simulate the transactions and the vendors can go out and practice, use it as part of their development cycle. So we really think it'll make the process efficient for vendors, and then they will come to us for an official decision on is their product compliant or not. But it has a great potential to really, really get to the plug and play point and make it easy for providers to understand the systems they're buying if they'll be able to connect and hook up to a state HIE if that's their goal. Perhaps they want to participate in the state of New York HIE, perhaps a more local HIE, or perhaps the providers have a goal of somehow participating with the eHealth Exchange. All of this will be the outcome of that program. We think it's really, really important.
Now, at HIMSS 13, there was a big announcement. McKesson, Allscripts, Cerner, Relay Health, all announced a kind of an interoperability alliance. Now, what does that mean for CCHIT?
Well, we're really eager to learn more about that, because I think one thing everybody in the industry would agree on is we've spent 10 years, or actually much longer, talking about interoperability, but we all want to see more of it. So anything that our stakeholders or participants in the community are doing to advance that, that's great. We've read the release, we've seen a few interviews, we've seen some analyst coverage, but we just really want to learn more. And we would like to engage with them and talk with them about the work we're doing, the system requirements and test cases that we're using that have been harmonized with the eHealth Exchange and the joint work group. We'd like to collaborate and learn more about that. If we don't do that, then I think we just create a little bit more confusion, because there are different initiatives out there, and we really need to make sure that we're all trying to collaborate and move in the same way. So we see more interoperability.
Now, from your perspective, what's left to be done on a health IT perspective? You know, what have we not yet addressed?
Well, we've been talking a lot about interoperability, so I'll kind of save my breath there, and I think everyone would agree we're getting started. This initiative that we're working on, actually going to be in the field pilot testing and having some certified products later this spring and summer. That's great. We have a long ways more to go, but if you start thinking about how that paves the way for future work, we're all looking at care coordination, right? And using data and the interoperability use cases with I'm a patient, whether I need to have a physician look up my record at a different specialist within my institution or a different institution or a different state. All of that comes into care coordination. What about discharge planning, or we talk about reducing readmissions, or it's care coordination is our next frontier as a part of health reform, payment reform. But again, interoperability is going to help us power that, I think.
And lastly, in your opinion, who's been the most influential health IT leader over the past decade?
What a fun question, right? We've all been thinking about that. Erin, I think I'd have to break that into sort of two, I'd look at it by the sectors. I'd think about it by the government sector and then also the private sector. So David Brailer in the government sector really set the stage. I mean, he articulated the issues in a very strategic form that got us all focused. He set the tone and started this revolution for adoption moving. So I think we can all look to his leadership and be grateful there. And then the other way I'd answer that question is sort of the view from the private sector. I'm a big admirer and fan of John Halamka's work, because he has taken everything that's happened and sort of shown the provider community how to adopt in a very personable way, right? By making himself very available, but also by participating in the development of policy and infusing that with a CIO's perspective to make better policy. So I would say that's how I would answer that, two different ways.
Well, perfect. Thank you so much, Alisa, for joining us today. We really appreciate it.
It's my pleasure. Thank you.